I'm a licensed and certified genetic counselor, and I work for a PGT lab called Genomic Prediction. PGT stands for preimplantation genetic testing, and it's a term that encompasses multiple genetic tests that can be performed on embryos created with in vitro fertilization or IVF. The purpose is to screen for genetic abnormalities in embryos prior to implantation in the uterus. There are several types of PGT tests, with the main types including PGT-A, PGT-M, and PGT-SR. Here are some factors to consider when deciding if PGT testing is right for you. All patients, regardless of age or family history, have some risk to create embryos with different genetic abnormalities. We know that this risk for chromosome abnormalities does tend to correlate more with increasing maternal age. Another factor to consider is your own personal fertility history. If you happen to have a history of recurrent miscarriages or multiple failed IVF cycles, and if you have a known structural rearrangement or balanced translocation, PGT-SR studies may be a good fit for you. Another factor to consider is the risk of inherited genetic disorders. If you know that you or your partner carries or is affected by a genetic disorder, PGT-M studies can be designed to screen for embryos that are free of that specific genetic condition. Lastly, personal preferences play a big role in deciding whether or not IVF with PGT is right for certain patients. So your own personal beliefs and values may come into play when deciding whether or not PGT testing is right for you. It's important to discuss PGT testing with your fertility specialist or genetic counselor to determine if it's a good option for you based on your individual circumstances. Regardless, we wish you the best of luck.